Hello everyone, and thank you for having me. First, let me introduce myself. My name is Aris Vindra Setiawan, and I am a postgraduate student from ITS Surabaya. Here, I want to present my paper, and the paper title is Monitoring Stroke Rehabilitation Relearning Program Using EEG Parameters, a preliminary study for developing self-monitoring system for stroke rehabilitation during new normal. Okay, let's begin. First introduction, physical distancing and all protocols for avoiding the spread of COVID-19 virus have been applied in many aspects of life. No exception also works on stroke rehabilitation. If the new normal protocols have not been adapted in the hospital, all the patients will be exposed to the spread of the viruses. A new approach is needed to keep rehabilitation process is safely done from the patient. To the solution, EEG is an alternative technology to support stroke rehabilitation program and monitoring independently. The purpose of stroke patient visiting hospital is to do the exercise as the form of rehabilitation program with the clinician observing and evaluating by filling the evaluation form regarding the process. But by applying EEG during pre and post rehabilitation program, the progress of stroke patient can be seen even more precise measurement because EEG technology can capture small change in the brain activities. Stroke is a condition that occurs when blood supply to the brain is disrupted or reduced to the blockage. That we call it ischemic stroke or rupture of blood vessel. This is a hemorrhagic stroke. Without the blood, the brain will not get oxygen and nutrition, so cells in some areas of the brain will die. This condition causes parts of the body that are controlled by damaged brain areas to not function properly. Medical rehabilitation in stroke patient or stroke rehabilitation is essential in restoring the ability and strength of body movement and improving quality of life. Thus, it is hoped that through stroke rehabilitation, it can stabilize medical condition, control condition that can be life-threatening, limit complications related to stroke, and prevent future stroke for recurring. The use of EEG tools or electroencephalograph can be an alternative in the process of monitoring and evaluating the rehabilitation of stroke patients. This device it can record electrical activity along the scalp. EEG measure the voltage fluctuation produced by ion currents in brain neurons. In this study, the authors tried to make observation on the motoric coordination patterns of stroke patients through objective measurement. This objective measurement is carried out using an EEG tool. An EEG sensor is attached by attaching electrodes to the surface of the stroke patient head. The result of feature extraction using the time domain from EEG will be used to determine the pattern of motor coordination in stroke patients. This study had 5 steps, namely data collection, pre-processing, feature extraction, and feature analysis and result. Literature review in study by Salvatore Iaquinto, MD et al. In 1994, it was stated that measurable EEG is useful for stroke rehabilitation patients so that improvements in motor brain function can be monitored. Meanwhile, in 2070, Cady Barter et al. Developed an EEG marker that can measure the index of brain involvement in stroke rehabilitation activities, where if the brain engagement index of BEI number is high, the success rate for stroke rehabilitation is high. methods. It is divided to three phases. One is early phase, is study of real literature, pre and post rehab data collection with a distant 1 month. Phase two is data processing, is pre-processing and feature extraction, and final phase is feature analyze. Data collection, when collecting data using EEG device, participants are instructed to do two movements according to the relearning program method, namely handheld movement and elbow movement. This is schema of the data collection. Start and roll 5 seconds. Movement, handheld or elbow, 5 seconds. After that, relax and so on until 60 seconds or 1 minute data collection process. Each participant was taken data 2 times, namely before rehabilitation, pre-rehab, and 1 month after that, at the time after rehabilitation, or we call it post-rehab. In total, there were 4 movement data for each participant, namely handheld movement data in pre and post-rehab, elbow movement data in pre and post-rehab. Pre-processing. The pre-processing process is carried out using one independent component analysis. This is for removing artifact. Then stop filter, reject filter, 50 Hz. This is to eliminate disruption from the electrician device. And three, EEG band filtering. Cutting data is eliminated from relaxing movements. Only movement data is taken, with amount data per movement is 1280 data, or 5 seconds multiplied by 256 data frames. After that, feature extraction. From the result of pre-processing, feature extraction was carried out with the mean absolute value, and standard deviation statistical features on each participant movement, both in the pre or in the post rehabilitation. Features released in the band alpha, alpha high, alpha low, beta, beta high, beta low, and theta. And this is also participant. This study involved 3 participants consisting of 1 male and 2 female. The participant's condition is the patient with the first attack with the affected body part of the stroke left or right. This is one example of feature extraction that comes out of the EEG result in participant number 3. This is handheld movement in the pre-rehab. And this is a handheld movement too, but it is in post-rehab. Okay, next slide is analysis. This is table of comparison of pre and post-rehab on participant 1 and handheld movement. As shown in above table, most of the statistical features of both mean and mean absolute value and standard deviation are decreased, where this means the number of statistical features at the time of post-rehabilitation is not higher than the number at the time before stop rehabilitation. The increased value, this means higher than the number before rehabilitation, is mean feature in the beta high, beta low, and theta bands. And this is comparison of pre and post rehab on participant 1 in elbow movement. In this table, it appears that most of the values show increase, which means that almost all statistical features at the time of post rehabilitation are higher than at the time before rehabilitation was carried out. Decreased values are only in the alpha high band, beta high for standard deviation, beta low for mean, and theta for standard deviation. And this is tabel of participant 2 handheld movement, comparison pre and post rehab. Most of the value indicated increase, which means the value of statistical feature at the time post rehabilitation is higher than value at the time before rehabilitation. For this shown that the success rate of rehabilitation in participant 2 is experiencing significant development, whereas the decreased value is only found in alpha high, alpha low, beta bands in the mean statistical feature. And this is a table of comparison in participant 2 elbow movement, pre and post rehab. Decreased value appears in mean statistical feature for alpha, alpha high, beta low, and beta band. When this means the mean number at the time of post rehabilitation is not higher when rehabilitation has not been done, while the rest increased values appear in almost all statistical features, which indicated the progress of stroke rehabilitation relatively shows improvement. And next, this is table of comparison pre and post rehab on participants number 3 handheld movement. In the table above, it appears that almost all values show increase, which means the number of statistical features at the time of post-rehabilitation is higher than when stroke rehabilitation was not performed. The decreased value only appears in mean statistical, beta high, beta low, beta bands. These results indicate that motor development of participant number 3 for handheld movement has experienced a significant development. Last table comparison of pre and post rehab on participant 3 elbow movement. Participant 3 has more decreased value as shown in the table above. This means that there are many statistical features at the time of the post rehabilitation which are not higher than before the rehabilitation. It can be said that the development of rehabilitation for elbow movement in this patient lacks significant progress. Your conclusion. This study tries to prove whether the data observation process carried out in the hospital during stroke rehabilitation is close to the data and numbers generated from EEG monitoring system. If the statistical feature of the data taken after rehabilitation show higher development than the data before rehabilitation, it can be said that the EEG can be used to help assess the success of rehabilitation process in stroke patients. From this study, it is proof that the statistical data features that appear in EEG data are in line with the data of physical progress in patients assessed by the doctor. From the 3 participants studied, participant 1 was the one who needed special attention, considering his medical history showed that the level of stroke rehabilitation progress was not good. Moreover, participant 2 and 3 tend to show significant level of rehabilitation progress. In addition, the pattern of the movement with the relearning program method or MRP is quite useful for retraining the motoric ability of stroke patients. Repeating simple daily activities can make a better progress for increasing the motor function of stroke patients. Okay, thank you for attention and goodbye.